Hi, my name is Heather Knapp, and I am from Boise, Idaho. I currently work as a pediatric trauma educator at a level 2 pediatric trauma center. But before that, I worked for many years as a bedside nurse and a charge nurse in the emergency department. I am also the region's pediatric emergency care coordinator and the region's TSC council secretary. I've been actively involved with Idaho ENA since 2008, holding several leadership roles, including the TNCC chair, EMPC chair, membership chair, state secretary, state president, and I am currently the immediate past president. I've also represented Idaho as a delegate and participated in ENA Day on the Hill. Additionally, I am faculty for both TNCC and EMPC. Beyond the state level, I've served on national committees, including the Conference Planning Committee, and I currently serve on the Lantern Award Committee. I hold a Master's of Nursing in Leadership and Management, and I'm a certified emergency nurse, certified pediatric emergency nurse, a certified professional in healthcare quality, as well as a Lean Six Sigma Green Belt. Outside of nursing, I enjoy being involved in musical theater with my daughter and staying active as an avid soccer player. Thank you. I'm seeking a position on the ENA Board of Directors because I want to contribute in a meaningful way to the future of emergency nursing through thoughtful leadership, collaboration, and advocacy. Through my work, community involvement, and both local and national ENA involvement, I've developed a strong foundation in aligning practice with evidence-based standards and driving system-level improvements. I've worked with both rural and urban emergency departments, strengthening my ability to adapt to diverse care environments and resource realities. And I would bring this perspective to the board to ensure decisions reflect the needs of all emergency nurses. One of the things I value the most about ENA is the relationships I've built through my involvement and participation in events. These connections have broadened my perspective and created opportunities to collaborate with nurses locally, nationally, and globally. As a board member, I would be committed to creating more opportunities for nurses to build these connections, strengthen our collective voice, and advancing emergency nursing together. I'm especially passionate about strengthening member engagement and mentoring emerging leaders. At the state level, I've worked with the local board to adjust the budget to better support member participation, increasing access to both local and national conferences, and creating opportunities for members to connect and become more engaged. I would bring that same focus to the national board to support a more connected and engaged membership. Serving on the board would allow me to bring together my experience, perspectives, and commitment to professionalism, integrity, and lifelong learning to support ENA's vision and continue advancing high-quality care for all patients. One of the biggest challenges I see for emergency nurses today is the constant balancing act between what our patients need and the resources we actually have available. We're caring for more patients with higher acuity and increasingly complex needs, whether that's behavioral health, pediatrics, or patients with multiple chronic conditions, while navigating staffing challenges, boarding, and system constraints that are often outside of our control. From my perspective as a clinical educator, I see how that impacts nurses every day. It's not just the workload, it's also the mental load, the emotional demands, and the pressure to consistently deliver safe, compassionate care in a very dynamic environment. And this is something I've experienced personally. For years as a bedside nurse, I felt that weight, and I just told myself to push through it, believing tomorrow would be better. But over time, I realized that wasn't really sustainable. It wasn't until I stepped into my educator role that I began to understand how much those experiences I had internalized and honestly suppressed. Even my husband noticed the difference. He shared that since I left the bedside, I seemed lighter, more present, and easier to be around. And that really impacted me because I don't want that experience for other emergency nurses. I don't want them to feel like they just have to get through it. And that's where I believe ENA leadership plays an important role. The challenge isn't just what we're facing, it's how we support and sustain our workforce through it, how we advocate for the resources, education, and systems that allow nurses to practice safely while also protecting their well-being. I'm really passionate about being part of that work, helping to create environments where nurses can thrive, not just endure, and ensuring we continue to advance high quality care for our patients. Thank you.